Cool. In our last video or in our previous video, we've given a brief intro to the skull or to bone growth anatomy. We've spoken about the terminologies that we're going to be using to describe our bone today, and now let us get into it. Great. So this is a skull, this is your skull, this is my skull. This is a human skull. Now we're going to be describing the skull and the bones and the landmarks of the skull. But first, we're going to talk about two divisions of the skull. If you've already noticed, our skull is not fully complete because our mandible, which is our lower jaw, is missing. It will be explained in a different video. But for the division of the skull is divided into the neurocranium and the viscerocranium. The neurocranium or the cranial vault is here. If you want to remember the name cranial vault, just remember that the neurocranium, or anatomically, the neurocranium houses the brain. The brain is housed, or the brain is surrounded by meninges, and the brain and the meninges are protected by the neurocranium. So just imagine a ball or a very important item. You are trying to store it or you're trying to keep it safe. You're going to put it inside a sack. So the brain is the important item. The sack is going to be the meninges, and that sack containing the brain or containing the important item, you're going to lock it up inside a chest or a vault because of how safe you want it to be. You want it to be protected. So this is our neurocranium or cranial vault. Then it is the bone of the calvaria or the skull for housing the brain. The second part or the second division of our bone is going to be the visceral cranium. So the visceral cranium is going to be the cranium of, it's going to be the skull part that houses different organs, especially that houses the different special organs or different sense organs, the eyes, the nose, and the mouth, like the tongue for taste. It's going to be the bones of the face, or is a comparison or a combination of the bones of the face. So that's our visceral cranium. So the neurocranium for the bones of the is the bones that makes up the cranial vault for protection of the skull or housing, for protection of the brain or housing of the brain, while the visceral cranium is the part of the cranium or the part of the skull that forms our face. Another important function of bone, which was not mentioned earlier, is the fact that the bone functions or helps to give shape and support to the body system. As you can see, this bone looks very much like something you see every day, which is your head or the head of your friend. This is because the skull gives the shape of the head. We're going to be describing the bones of the skull, the landmarks of the skull, and whatever important thing you need to note about the skull. The first bone we're going to talk about would be the frontal bone. Now, this is the frontal bone, and the frontal bone is a flat or is a squamous bone. It's a flat or squamous bone, and as you can see, it projects, or it is what is depicting the forehead in the human head. This is a suture. If you remember our description or our definition of a suture is a type of fibrous joint. A fibrous joint or a joint meaning that it joins two bones together, so two or more bones together. So this suture joins the frontal bone to the parietal bones. So these are the parietal bones, they are paired. So this suture joins the frontal bone, again, this is the frontal bone, to these two bones at the back, the parietal bones. Now, the name of this suture is the coronal suture. What I'm talking about now, the coronal suture, is an important landmark on the skull, so you can write it now. You can write it down. This is the coronal suture. The coronal suture functions to join the frontal bone and the two parietal bones. So again, this is our frontal bone, and this is our coronal suture, which is the joint that holds the frontal bone and the two parietal bones. So when we come here like this, these are the two parietal bones. These are the two parietal bones. And this suture that is joining the two parietal bones is actually called the sagittal suture. Back to our frontal bone. This again is our frontal bone. Now there are some very, very important landmarks or important parts we need to note on our frontal bone. Now this part of the frontal bone is called the supraorbital margin. Remember when I explained what margins are? A margin is the edge of a bone, is the edge or border of a bone. So this is the supraorbital margin. Supra, above, orbital, orbit or orbital, above the orbital. So the margin that is above the orbit, supraorbital, the margin that is above the orbit. Your orbit is your eye. Cool. Now on our supraorbital margin, we have a brief or a very little indentation or notch. What did we say indentations are? We said notch, and we said our notch is also intermittently used as or intermittently called a foramen. Indentation of foramen is called the supraorbital foramen. It is more pronounced here, or it is more visible here. The supraorbital foramen, and this supraorbital foramen functions to aid the passage or the conduit of supraorbital vessels. Now, if we go closer, or if we come closer to this skull, let us come here. Now here you can see this is a bump, a brief bump. I don't know if you can see it. This part, and this part. See, as my hand is going, as this thing is going like this, it's going now. There's a brief bump. Now this bump is called the superciliary arch. This is the superciliary arch for this part, and this is the superciliary arch for this part. Now the superciliary arch is important because resting above or traveling above the superciliary arch is actually superciliary vessels, and clinically this is significant in the formation of a black eye or a purple eye when force is directed towards this superciliary arch. It causes a break or tear in the vessel, which causes the pooling of blood and blood clotting formation, which would cause that bluish purple or that purplish coloration around the eye. So this is the superciliary arch. Now, if you couldn't see it clearly, like the projection, this is it. Immediately, since I said superciliary is a projection, so immediately behind the superciliary arch at this point here is a very short or very small brief depression. Now this point, this brief depression is called the ophyron, O-P-H-Y-R-O-N. It's called the ophyron. This is a landmark of the skull. It's an important landmark of the skull. Now, if we are to turn our skull like this, we said if we are to turn our skull laterally, the lateral view of the skull, we said this is our superciliary arch. Above the superciliary arch is a brief depression. Now, immediately above that brief depression is this point that is a projection is actually called the glabella. It's called the glabella, and it is the most prominent or the most prominently projecting anterior part of the frontal bone. It's called the glabella. The glabella is not very obvious in this. It's not very obvious in this bone, but if you check anatomical diagrams, you see that glabella. Now, this point, let me zoom in here. This point is also very important. This point is called the nastion. Here, it is not clearly visible, but this point is where the frontal bone meets with the nasal bones. Okay, it's the point where the frontal bone meets the nasal bones, the nastion. That's what it's called. It's called the nastion. The nasal bone to be here. The nastion is along the nasal suture. So if this is our nasal suture, which is joining the frontal bone and the nasal bones, then this point is our nastion. It's an important landmark of the frontal bone. Now, when we put our frontal bone in this direction, again, I'm going to describe our coronal suture. The coronal suture, this is it. It is what joins the frontal bone and the parietal bones together. It is what joins the frontal bone and the parietal bones together. Yes, we've gotten to where you've been wondering since. This point that has been circled here, this point is called the bregma. The bregma, the bregma. Now, the bregma is the point where the coronal suture meets the sagittal suture, or the point where the sagittal suture meets the coronal suture. So this point is our bregma. It is mostly visible superiorly. This point is our bregma. Now, the bregma is important is because when closure of sutures happen, it begins from the bregma. I am saying closure of sutures because human beings are not actually born with some specific parts of this skull. For example, a newborn baby will not have a bregma present because the sutures have not finished joining together and have not finished forming. That means the brain of a newborn baby has not fully fused together. In place of this bregma, now I said this bregma has not been formed in a newborn baby. So if we eliminate this bregma, or if we cover this bregma like this, what does that leave us? No, it is not two fingers that are there in the skull of a newborn baby, but it leaves a space like this, which is where this black marker is also outlining, a space, and that space is going to be called a frontal nail. That space is going to be called a frontal nail. So a frontal nail is what is present. Frontal nails are present in newborn babies at the point of suture, or the future point of closed sutures, or where closed sutures would meet, but it is absent in a newborn baby because if it is present, it is going to negatively affect the birthing process, which is as the baby is sliding out of the birth canal. Because if the sutures are there, that means if the bones of the baby are fully formed and have fully joined together, it will be very difficult and almost impossible for this to come out of the canal, the reproductive canal of a female. Great. We have just about finished almost all. I'm saying almost all because there are still a few more landmarks to note about the frontal bone, but we have finished almost all the landmarks of the frontal bone. We're going to move to the parietal bones. Now, the parietal bones are paired. As you can see, paired is 2. 1, 2. The parietal bones are paired, and the sagittal suture functions to separate the parietal bones from each other. The sagittal suture, it functions to join. It shows the separation that they are actually two, but it actually functions to join the two parietal bones together. This parietal bones functions to join them together. Now, as I said before, the place where the sagittal, so this is sagittal, just imagine like the sagittal view of the human body. So this where the sagittal suture and the coronal suture meet is called the bregma. And this is another suture. This suture is called the lambdoid suture. So where the lambdoid suture and the sagittal suture meet is called the lambda. This place lambda, this place bregma. Along the sagittal suture, although not actually shown on this skull, along the sagittal suture is actually a point called the obelion. Let's just imagine it to be here, the obelion. Now, the obelion is the part on the sagittal suture that is immediately facing or is immediately adjacent to the parietal foramina on the parietal bone. Now, the parietal bone actually has foramina, one on the left side and one on the right side. The parietal bone actually houses foramina, and this foramina is for the passage of parietal vessels. The point in the middle, or the point where the parietal foramina is in line with the sagittal suture, is called the obelion. Lambda, obelion, bregma, coronal suture, sagittal suture. If you go to the back, this suture is called the lambdoid suture. As I said before, the lambdoid suture. And then the lambdoid suture functions to join, or functions to create a union between the occipital bone, this is the occipital bone, and the two parietal bones. Occipital bone is not paired, frontal bone is not paired, but the parietal bones are paired, and there's another set of bones on this neurocranium that are paired. But right now, let's talk about this, our occipital bone. So our occipital bone is the ikpari of a person's head. The occipital bone is at the back, is mostly seen in the posterior region, and Along the lambdoid suture, if we zoom in here a bit, along the lambdoid suture, so you can see now, this is the lambdoid suture. But then it looks like here, it looks like there's an extra part of the lambdoid suture. Like, let's say this is our lambdoid suture now. It now looks like there's a bit of a thickening here. No, it is not a thickening. That part is actually called the Wormian bone. So the Wormian bone is also part of the suture, but anatomists have, separated it. They delegated it to be the Wormian bone, but it's also part of suture. So the Wormian bone, this is the Wormian bone. It is along the lambdoid suture. Another landmark we can find on our occipital bone, though not very prominent or very evident here, is going to be our external occipital crest. If we are to imagine our external occipital crest, I would say it is here. I would explain why soon. But external occipital crest, it is actually the most prominent or the most protuberant part of the occipital bone. Now, the reason I was able to try and locate this as the external occipital crest is because nothing is taken for granted here. But as you can see, if I turn it like this, the shadow, you can see that there's like a heel or something is coming up like this here. This part is coming up, this part is projected, or this part is prominent, it's coming out. It's an outgrowth, it looks like an outgrowth. So this part that looks like an outgrowth, it has an inferior part and it has a superior part. See, I'm not lying, no, I'm not making it up. See, this is this inferior part, and then this is the superior part. So it has an inferior part and a superior part. So it has an inferior part and a superior part. Cool. So the superior part, I said this part, we're going to delegate this part as our bregma. This is going to be the inferior part, this is going to be the superior part. So we're going to delegate this part as our bregma. Now, our bregma, okay. Now, no, I don't say bregma as our external occipital protuberance, not bregma. Now, our external occipital protuberance is flanked on two sides, is flanked on its sides by the superior notchal line. This part under is going to be the inferior notchal line. Sorry, this part under is going to be the inferior notchal line, and then the part above it will be the superior notchal line. Okay, it is not very evident in this score, but please go to whichever bone museum you have in your colleges of study, or you can just open your Atlas anatomy textbooks. Great. The last landmark we're going to be talking about on our occipital bone would be these occipital condyles I spoke about before. In our last video or in our previous video, we said the occipital condyle so we said the condyle is defined as a circular protuberance. Okay, it's not just a protuberance, but it's a circular protuberance, and it is majorly involved or majorly found in joints or around joints. Cool. This hole, I'm not going to talk about it much, but this hole is foramen magnum. Foramen magnum. Now, the next bone we're going to be talking about in our neurocranium of our skull is going to be the temporal bone. The temporal bone. You know, I told you the parietal bones are not the only paired bones in the neurocranium. We also have our temporal bone. This is the temporal bone here, and this is the temporal bone here. Cool. I will use this side. The temporal bone, the major significance or the major importance of the temporal bone is this part, this formation here, or this part here, which is called the pterion. Now, our pterion is where the temporal bone, the parietal bone, the frontal bone, the parietal bone, the frontal bone, and the sphenoidal bone meet. So this form, it looks like a H, or it is H-shaped. So it is H-shaped. Now, our pterion is important not just because of the coincidence it has that it looks H-shaped, but also because clinically the pterion overlaps the anterior branch of the middle meningeal artery. So in case of fracture any fracture to this point, this terion point, will break the vessel or will tear the vessel of the middle of the anterior branch of the middle meningeal artery, thereby causing, a brain bleed or a bleed into the meninges of the brain, or the meninges covering the brain. What I'm going to say about the temporal bone is that over here, it comes in contact with the lambdoid suture. Over here, it comes in contact with the lambdoid suture at a point that is called the asterion. It doesn't really have as much of a clinical significance as the terion. It's just a point that meets the lambdoid suture, called the asterion. If we come to the other side, we will see this. Now, this is also part of our temporal bone, even though it is not very clearly shown here or even here, but the part where this part is called the superior temporal line. So the part where the superior temporal line meets the frontal suture is called the stephanion. If we were to visualize it, that means it would be somewhere here. So the part where the superior temporal line meets the frontal suture is called the stephanion. So the stephanion is above the terion. The stephanion, the terion, the asterion. Concerning our temporal bone also is this part. Now this part is the mastoid process. It is more obvious on this part. This part, it projects more than this, but this part is called the mastoid process. This is the mastoid process of the temporal bone. This part that is projecting outwards like this, it is a part of the temporal bone, but it is a process of another bone, or the process towards another bone, called the zygomatic bone. So since this part is coming out of the temporal bone, but it is heading towards the zygomatic bone, so this part is now going to be called the zygomatic process of the temporal bone. Meaning it is actually coming out of the temporal bone, but it's heading towards this place, towards the zygomatic bone. So it is the zygomatic process of the temporal bone. So let us do a quick review. This point where the frontal suture meets the nasal suture is called the nasion, and this is the nasal suture. This is the frontal bone. This is the nasal suture, and these two is not very obvious, but it's the paired bone. The nasal bones, they are paired bones. This part is the supraorbital margin. This is the supraorbital foramen or supraorbital notch for the transfer of supraorbital vessels, or the conduit of supraorbital vessels. Immediately above the supraorbital foramen part, this is the superciliary arch. Immediately above the superciliary arch would house the superciliary vessels, which is clinically significant, the black eye. Now, immediately above the superciliary arch, in the middle, immediately above is like immediately above it's going to be our ophirion. Immediately above our ophirion will be our glabella. Our glabella is the most anterior projecting part of our frontal bone. This is our bregma. This is our coronal suture, parietal bone, parietal foramina, obelion. Just do a recap. We are all smart. You guys are smart. All right, now we are going to talk about the parts of our viscerocranium that are visible now, or that we have now. I'm saying it like that because we currently do not have the mandible. The mandible is going to be located somewhere. It's going to be located here. Actually, the most anterior part of the mandible is going to be located here. It forms our lower jaw. We don't have that here now, but in another video we will discuss more about the mandible because it has more landmarks than all the other bones, and it's also, as you can see, it is not a direct bone of the head of the skull. Like, it is not directly attached, fused by sutures, so it is detachable if you break somebody's jaw. One thing that was not mentioned as part of the temporal bone is our external auditory meatus. So this external auditory meatus, this is it here. So it's like a small hole. External auditory meatus, so it is involved in the hearing process. It is involved in hearing. This is where your ears are located in your skull. So under your ears or a bit inferior to your ears, you will feel a bony projection. That will be your mastoid process. And although you cannot feel it, but this where your ear is connected to, like the canal, if you go into the entire part of the ear, the outer ear, the middle ear, and the inner ear, or you know that all roads concerning the ear lead to the external occipital meatus. Now, on the viscerocranium, so on the neurocranium, if you've been following, you know that we have 8 bones. We have 2 paired set of bones, that is the parietal bone 1, 2, and the temporal bone 1, 2, making 4. And then we have 4 singular bones. Out of the 4 singular bones, only the frontal bone and the occipital bone and the sphenoid bone were mentioned. If you remember, we actually mentioned the sphenoid bone when we were talking about the asterion. The last bone is the ethmoid bone. The ethmoid bone is part of the viscerocranium, part of the neurocranium, but it's just it just gives a very, very small contribution, and as you can tell, it's not actually visible here. It is if we get access to our skull cap. If we get access to our skull cap and we open it, that's when we'll see our ethmoid bone. But the bones of the viscerocranium, of the neurocranium, there are 8, 4 singular, and then 2 paired. Now we're going to the bones of the viscerocranium. The bones of the viscerocranium, there are 15 in total, 3 singular and 6 paired. 3 singular and 6 paired. So the 3 singular bones of the viscerocranium we have are the 3 singular bones of the viscerocranium we have are the maxilla bone. The vomer is found here, but you cannot exactly see it. Sorry, here I can see it. So the maxilla bone, the vomer, and the ethmoid. Again, I said the ethmoid actually makes a small contribution to the neurocranium. So it's made the major contribution of the ethmoid bone is actually to the viscerocranium. Okay, so those are the 3. Again, a recap. The 3 singular bones of the viscerocranium are the maxilla, the ethmoid bone, and the vomer. Now, the 6 paired bones of the viscerocranium, let's count them together from here down, even though this down part is invisible. Let's count them together. The first ones are going to be the lacrimal bones. So the lacrimal bones, they are found here inside the orbital region. If you actually put your finger, I didn't say put your finger in your eye, but if you check along this side here, you would feel a very small projection of prominence. Those are your lacrimal bones on both sides here. Those are your lacrimal bones. So that's the first set of paired bones we have in our viscerocranium. So the second set of paired bones we have in our viscerocranium are our nasal bones. Remember, I said this part is the nasion, this part is the nasal septum. So we have our nasal bones. They are paired, left and right. The way you have your left nostril and your right nostril, we also have the left nasal bone and the right nasal bone. So first lacrimal bone, second nasal bone. So the third set of bones that we're going to be talking about that are paired are going to be your zygomatic bones. So these zygomatic bones or cheekbones, they are very prominent. You know, you can touch them or you can feel them or you can palpate them in your own body. So this is the zygomatic bone. This is the zygomatic bone. This is the zygomatic bone. Cool. So that's the third paired set. Then the fourth paired set is going to be the inferior nasal concave. Also not visible here, but inferior. So it will be down, located inferiorly. So the nasal concave, there are 3. The nasal concave, yes, there are 3 shelf-like projections that are found in the nasal cavity, that are found at the lateral part of the nasal cavity on both sides actually. So this is going to be our inferior nasal concave. So our middle nasal concave will be here, and then the superior nasal concave will be here. But for bony projections that are paired, in this case of the viscerocranium, we're going to only be talking about the inferior nasal concave. So we said lacrimal 1, nasal 2, zygomatic 3, inferior nasal concave 4, Number 5, which we unfortunately do not have here, is going to be our mandible. Number 5 is going to be our mandible. Our mandible, yes, is a paired bone, so the suture is actually located in the middle of it, like in its middle, so it's paired. And then the last, number 6, is going to be our palatine bone. This is our palate or our palatine. This is our palatine bones. If you zoom, it doesn't actually look like there's a suture there. It doesn't look like they are paired. But if you zoom in, or if you go to the lab, or if you open your book, you need to read your book. If you don't read your book, I don't know what's happened to you, but you need to read your book and see that there's a straight line here, and that straight line is the suture which marks or which shows the fact that it is a paired bone, or there are 2 bones that are associated here. So lacrimal bone, since it's so small, I mean, I'm not aware of any landmark of the lacrimal bone. Same as the nasal bone, not really. But the next one we're going to be going to would be our zygomatic bone. Our zygomatic bone. Now I'm going to be talking about our zygomatic bone. This is our zygomatic bone. Remember, temporal bone is going to give zygomatic process of the temporal bone, and our zygomatic bone is also going to give a temporal process of the zygomatic bone. Now, the zygomatic bone gives a temporal process, the temporal bone gives a zygomatic process. Now, when the temporal process, let's take it again. When the temporal process of the zygomatic bone comes together with the zygomatic process of the temporal bone, it forms our zygomatic arch. This arch here, it forms our zygomatic arch. Yes, it's a tongue twister. You can try it later. So it's called, it forms our zygomatic arch. So that's one of the things we have, or one of the landmarks we have concerning our zygomatic bone. Concerning our maxilla, now our maxilla gives as you can tell already, it gives the most contribution of our viscerocranium, or of our face. It's extending from here like this. Yes, it's joined to the temporal bone here. So here, this hole you can see, you people are so smart, I like that. This is the infraorbital foramen. This is the infraorbital margin. This is the infraorbital foramen. Passage of infraorbital versus infraorbital foramen under our orbit. This is not very obvious here. I think this is it, infraorbital foramen, passage of infraorbital vessels. So this part that is pointing out here is actually called the anterior nasal spine. It's called the anterior nasal spine. This part here, that's the beginning of this big hole. This part here, the top of this triangle, is called the rhinion. It actually comes out a bit. It's just, I think it has broken off a little bit from here. But the rhinion, and then the anterior nasal spine. The anterior nasal spine is on the maxilla. Okay, the maxilla bone. So as you can see here already, coming out or a part of the maxilla, or coming out of the maxilla bone, these are the teeth. These are real human teeth. These are teeth. So the part where, or the ridge which from which the teeth is coming out of, this ridge, this bone, like this, this is called the alveolar ridge, and the alveolar ridge is where the teeth they are embedded in, or where the teeth they come out from, the outgrowths, like as they are growing out, they come out from the alveolar ridge. So in this video we discussed about the neurocranium and the viscerocranium, the parts of the viscerocranium that were present here.
We also spoke about the clinical significances of some landmarks. Thanks for watching. We are Dicot is fam. Please don't forget to like, subscribe, and forward this video to whoever needs it. Bye.